Hello everyone, I'm Dr. Shri and welcome to our initiative, What After Dentistry. Today, we have with us Dr. Rahul Gogoi, a facial plastic surgeon at Skulpt-Face Facial Aesthetic Clinic, Guwahati. He graduated from the Cool Institute of Dental Sciences in 2010, and then he went to pursue his MDS in oral and maxillofacial surgery from the Army College, Sankaradeva. After the completion of MDS in 2015, Dr. Gogoi worked in various roles such as the Chief Consultant in GNRC Hospital, Guwahati, a fellowship instructor in the Department of Oculoplastic Aesthetics, Sri Sankaradeva Netralaya Hospital, Guwahati, and finally as the director of the Skulpt-Face Facial Aesthetic Clinic, Guwahati. He has also completed his fellowship in facial plastic surgery from Beirut, that's Spanish Society of Facial Plastic Surgery, and a fellowship in facial aesthetics from the International Academy of Aesthetics. Dr. Gogoi is a fellow of International Association of Maxillo-facial Surgery, Chicago. He has published various articles in various international journals and keeps himself abreast with the latest advancements in the field of facial plastic surgery. We welcome you, Dr. Gogoi, and it's a pleasure to have you on our platform today discussing the scope and opportunities as a facial plastic surgeon after MDS in oral and maxillofacial surgery. We welcome you once again.
Thank you for the invite. It's a very nice opportunity for me to speak on my journey towards maxillofacial surgery and towards facial plastic surgery. As I was asked how I started my career towards facial plastic surgery, what happens is that as a BTS graduate, we really don't know what is the scope of maxillofacial surgery and how to go about it. A lot of times, like when I was a small young graduate third-year student, so I used to see, sometimes I dislike the attitude of certain staff, honestly speaking. They never interacted with us properly, and they were always busy with the postgraduate students most of the time. So you, as graduates, you really don't know what are you going to do. And even at that age, the age of 24, 25 is not a very intellectual age where you can actually decide what you want to do. So surgery is vast. As graduates, we really don't know much about surgery apart from standard little bit of trauma and implants. So if you go into the spectrum of surgery, so you can see that you have minor oral surgery and implantology, which every BDS graduate should be able to do. This is basic bread and butter. Apart from this, once you graduate as a postgraduate as a maxillofacial surgeon, your maxillofacial trauma becomes your bread and butter. That is your basic skills which you acquire as a freshly passed out OMFS surgeon. And after that, then it comes the subspecialized or super specialized subjects, such as you have maxillofacial oncosurgery, that is cancer specialization. Then you have your cleft and craniofacial surgery. And last but not the least, you have facial plastic surgery.
Right.
Here, since I am into facial plastic surgery, I've done my fellowship in facial plastic surgery. So I'm going to speak more about facial plastic surgery as the topic suggests. So as a maxillofacial surgeon, there are certain inherent advantages that we have. One is that we are well versed in the anatomy of head and neck region because we spent 3 years in just head and neck. So the only anatomy we read is head and neck. And even as dental graduates, the anatomy which we read is again head and neck only. So we are very good with that particular anatomy. And during our specialty training, we get good surgical exposure into facial trauma and pathology, indirectly also giving us good idea of how the anatomy of the face and the head neck region is. Right. Another crucial part which we tend to ignore is that the orthodontic exposure. Because we are associated with a dental college and all maxillofacial surgery postgraduate centers also have orthodontic training centers. They also have postgraduation in orthodontics. Right. That is where we get treatment planning, and facial aesthetic and facial analysis is a part of our curriculum. So it's not just a hard tissue. People just think trauma, trauma, trauma. It's not just a trauma, because facial analysis, soft tissue analysis, hard tissue analysis, these are all part and parcel of our curriculum. And orthodontic surgery is actually the first step towards facial aesthetic surgeries. So coming to my journey, it's been a little bit of long, protracted journey. In 2015, as I told you, I finished my post-graduation. And this is how I tell all the fresh pass outs. People fresh pass out, fresh MDS, 1 or 2 years into after passing on maxillofacial surgery. They keep asking me, sir, that Dr. Rahul, how did you proceed with this field? What did you do? So this is what I tell each and every one of them. So I'm just sharing it in the PPT format. What I say is that when I started my practice, in the first 3 years, I did only exclusive oral and maxillofacial surgery. It was difficult in the sense because when you come out, in general, because you have a BDS background, so people tend to see you as a dentist. So they don't see you as a specialist. Most of it's very common. It's very common. You open a clinic, you are expected to do general dental treatment also. But what was there in my mind was that I've never seen an ENT surgeon doing general medicine consultation. I've never seen a MCH neurosurgeon doing a laparoscopy surgery. He did MS in general surgery, where he learned laparoscopy surgery. They used to perform laparoscopy surgery. But once he specialized in MCH and neurosurgery, he never went back. It was always going forward. An ENT surgeon never goes back to medicine practice. He goes forward. He does general ENT. After that, they may go for skull-based surgery. They may go for head and neck oncology. Even they go for facial plastic surgery. They never go back. Yeah. So that is what I thought. General practice is better done with people who are concentrated in general practice. That is general dentist. Like how medicine practice or in our hospital, when you have an emergency case, it's the resident medical officer who sees all the emergencies. Only when he or she cannot handle the particular emergency, say they have a nasal bleed, and the standard instruction is, I've given them set of standard instruction. You do these steps, the bleeding should stop in 90% cases. In case it doesn't stop, then you give me a call. I'll go and I'll see what can be done. So when I passed out, I had the same outlook that I should not be. I've spent 3 years in specializing myself. I've not done GP practice in the last 3 years. In fact, it was 5 years. 2010 was the last I did a general dental practice. So when I passed out in 2015, it was 5 years. 5 years is a big, long time. It's equivalent to doing BDS altogether again. So I had this in mind that I'm not going to do general practice. I have to do justice to my specialty. So that's how I started off. It was tough initially. My parents were very supportive of me. They said, fine, you do what you want. They gave me a few years of time. They said, you have few years, okay? You see, if you can make it, you do it. Otherwise, then we look at it. So I had that freedom. So I started working only towards my specialty practice. And eventually I got through multiple hospital attachments. That's how I got through. I did not open a clinic first. So I went through, I was attached with Namepet Hospital, RA Hospital, 6 Mile GNRC, Gate Hospital, numerous hospitals all throughout Guwahati. So I attached myself with only for maxillofacial surgeries for trauma, exclusively for trauma. And then I also started visiting multiple dental clinics to give me some consultations as wisdom teeth extractions, or maybe implants, or maybe if any kind of pathologies come. And it was only in 2017, mid-16, that I opened my clinic. And even when I opened my clinic, I did not do general dental practice in the clinic. I had one associate dental surgeon who used to handle all the dental treatment. And I used to do only maxillofacial surgery. That is, at that point of time, it was limited to maybe extractions of surgical extractions, maybe cyst enucleation, implants, and all those minor procedures. This carried on from 2015 till 2018 till I was building my base towards more sound surgical practice. And during this time, I also started further training myself and consolidating my reputation as an aesthetic surgeon. So that's what many people ask me, how did I do it after maxillofacial surgery? So one of the key things which I used to do was I give my 100% to all the surgeries, and I started doing all the surgeries, trauma surgeries, and make it with minimal scar and maximum emphasis on aesthetics along with function. So it was like, if I do an orbital fracture case, I never went from outside. It was always a hidden scar. So that's how I started. So my patients who were trauma patients started knowing that I do very good aesthetic results of my trauma cases. I also went through multiple courses. I went for facial plastic surgery in Singapore. I got attached myself with Oculoplastic department in Netralaya Hospital, where now I started as an attachment, and now I'm faculty in that same hospital where I learned. So I'm grateful to the department there. And along with that, I started attending numerous workshops on facial aesthetics. And finally, I also went for my facial plastic surgery fellowships under the Spanish Society in Beirut. That is how I started. So I started performing all my facial trauma cases with good approach, minimal scars, performing orthodontic surgeries, distraction surgeries. And by the time it was 2018, the hospital, the medical colleagues in my different hospital started getting more confidence in my skills as a surgeon. And I started getting referrals from them. So I now I do have referrals from neurosurgeons, ENT surgeons, even facial trauma. Many people, they don't believe me, but yes, ENT surgeons do refer me facial trauma cases. Even plastic surgeons call me for complicated fracture cases. And for all kind of craniofacial cases, oculoplastic surgeons also give me a call. So, and it was in 2018 when I took the actual leap towards the facial plastic surgery that I did my first independent rhinoplasty and blepharoplasty. And that is when this was my critical juncture where I started leaving all the other hospitals and I started concentrating in building now, whatever the reputation which I built, I started building on that. So that is how I built. So now, as of now, I'm just consultant in only in one hospital. So I don't go to multiple hospitals. It's just one hospital where I am the chief consultant. So this took time. It took almost 4 years for a hospital to agree to give me a department. And 4 years I had to work hard because, when I first went in as a maxillofacial surgeon, they looked on me as a dental surgeon. And it took me a long time to convince them that, no, I am not a dental surgeon. I am a maxillofacial surgeon. So it took time, but yes, I stuck with my motto. I did not bulge to the pressure of doing dental practice in the department. In my hospital, there is a dental department and there are dental consultants there. And I don't even do extractions in my hospital. It's not done by me. We have a periodontist. She does all the extractions. We have an orthodontist who does orthodontic practice. And I am not there. I'm just, I'm a consultant in the facial plastic surgery department. So it took 4 years for me to develop this, but it happened finally. And plus, I have my own clinic set up in Guwahati. And as a visiting faculty, I became instructor, fellowship instructor in 2019. 2020, sorry, 20, I had my first fellows joining me. So it's a long journey. It took time. I'm not a very rich surgeon. I'm a very poor surgeon because we tend to spend a lot of money in training myself. So whatever I was earning, most of it was going back into training myself and still going on. So my wife's not, sometimes she gets angry that I don't have any money, but she's also an orthodontist. Now coming to facial plastic surgery after MDS in maxillofacial surgery, the best way to go around is courses and fellowships. Courses, there are very few. At Dr. Mohan Thomas in Pune, Dr. Sunil Richardson and Dr. Srinivas Ghosla. So they have officially recognized facial plastic surgery fellowships in India. Apart from that, not many options as of now because it's a very nascent, it's a very new field. In general, the Indian population itself is not very aware. Another orthodontic surgery fellowships by OMFS, because when you do orthodontic surgery, your anatomy gets clear. So it's all about your basic foundation. Your foundations are good, you can just build on that. If your foundations are weak, you cannot really build on anything. And there are a lot of workshops in rhinoplasty, blepharoplasties, which I attend. I still attend a lot of workshops in aesthetic surgeries and all those things. Then you have a lot of overseas training and observerships. Like I am a member of the European Academy of Facial Plastic Surgery. So I've done my observerships over there in Europe. I've also done my fellowship under the facial plastic surgery. And I'm also supposed to go again because of the pandemic. It slowed down, but I was supposed to go to California. I was supposed to go to Turkey. So all those things are in place, but it takes a long time, gestation. So the scope, coming to the scope of maxillofacial surgery. This is one question which everyone asks me. Okay. My guide was very encouraging, Dr. Sadam Srinivas Rao. He gave me a lot of free hand in surgeries, traumas, and everything. Unlike my some other staff, I will not say name, but some other staff who were like, there's no scope in surgery. It's never there. When people say there is saturation, no, there is no saturation. In a country of 130 billion people, 130 crore, you can never have saturation. It's impossible. You build your own market. That's it. You build your own market. When I first came down to Guwahati after finishing my surgery, Guwahati is a two-tier city. It's not a big city like Hyderabad, Bangalore, or Mumbai, Delhi. It's a two-tier city where we don't have the film industry, right? We don't have a big fashion industry. So when I came here, people said, no, there is no scope. That's what I was told, everyone, very clearly. And they told me, stick to your trauma, stick to pathology, or try to get head and neck cancer fellowships and all those things. And now it's been 7 years. I've done 750 surgeries. And if you look at my figures in 2020 to 2021, last year's figures, I've done 220 surgeries, which includes 44 rhinoplasty and 80 blepharoplasties. So more than half of my practice is rhinoplasty and blepharoplasty, which was supposed to be very difficult and rare in a place like Guwahati. But this is my figures. I've kept my figures in front of you. Trauma is just 17% of my practice, and I don't do any kind of minor surgical practice. You can see here, I've not included impactions, or I've not included the cyst and the small things. So yes, market, there's never a saturation. You build your market. So there is a huge scope, not just in maxillofacial surgery, even in dentistry. My associate dentist who's there in my clinic, her even in pandemic time where the overall number of cases are low, patients are low, she's generating more than 1 to 1.5 lakhs in a month. So that is when the pandemic has slowed down. And it's not like I'm a very senior, 10 years, 20 years old practitioner. I'm a very fresh practitioner. And people don't come to me for general dental practice. And she's also young. She's just 6 years into practice. She's my own cousin, actually. So she's just 6 years into practice. And she's doing fantastic. So it's never about, and the same thing, it's in the same road where my clinic is. In that 1.5 kilometer stretch of the road, there are 12 dental clinics. In that 1.5 kilometer stretch, there are 12 clinics, and our dental section is still working fit and fine. So there's no saturation. It's a myth. There's a saturation. It's not a saturation. Your principle should be good. You have to focus on your strength and build on it. So that's what I tell everyone. There's never a saturation. Coming to pure scope, you can see here, these are few of my cases of rhinoplasty. One case, the case on the left, the guy, he's actually a doctor. He's an IVF specialist. So he's a doctor from Shillong. And he did his research from all the way, and then he chose me. I have many doctors as my patients who've undergone rhinoplasty, I have medicine specialists, I have surgical specialists, I have plastic surgeons who've come to me for their aesthetic surgeries, and I've done it. And you can see the amount of difference you can actually create. Just the nose, you can see in the way the doctor, he's got the confidence in his eyes with the surgery itself. So when you see these results, when you work hard towards it, this is what you are looking for, your satisfaction. You're following your passion and you're satisfied. Your patient is happy, you are happy. Then you have a blepharoplasty. You can see the transformation in the girl from the top picture when you see how the eyes look, and when you go down right to the bottom 1 year post-surgery, and you can see the twinkle in her eyes. And when you see this exact twinkle in the eyes, the happiness, the brightness in the eyes, you feel, yeah, it's worth it. It's worth the sacrifice and the trouble you've gone through. On the right side, it's my mom. I did her rejuvenation. She was after me. Initially, I was scared. It's my mom in the end. But then it was my brother's marriage, and she said, no, this time she won't take no, and I have to do it. And from the top, and this is how she looks now before my brother's marriage. So yes, you can do this, and it's pretty satisfying job, especially when it's your parents also, when they come to you. Then facial contouring procedures, you can see here left and right, before and after. She looks like totally a different person, a more feminine face, more softer face, more balanced, well-balanced out face. Then you have it's not just about cosmetic. You have facial paralysis patient. My very lovely, very sweet patient of mine. She had facial paralysis post-surgery, post-tumor surgery, actually. She had a parotid tumor. And you can see down the line, down the picture, her face is straight. She's happy. You can see the WhatsApp message they sent me. She can eat, laugh, even close her eyes. So she's happy. So you are actually making your patient happy after the surgery. Then you have this beautiful lady. She's my overseas patient. She's not from India. She's from Bhutan. And you can see here, she looks 10 years younger. In her heart, she's in her 30s. But she looked 40s. She's actually in her 50s. And now after the surgery, she looks well into her 30s, lining up with her spirit, very bubbly spirit. And you can see the difference, what you can call. You can see in the eyes itself, the amount of freshness, that the confidence they exude after the particular procedure that you've done. Then distraction surgeries again. This is again a case where the girl never knew. This particular family didn't even know that the treatment can be done. She was 21. She's getting married now. So you can see the difference you can make in their life. This girl, with this kind of thing, it's difficult because she can't open, she can't speak, and now she can speak, she can eat, she can walk around without people staring at her face. Then you have orthodontic surgery. Again, you can see how deficient, and again, she looks normal. Then post-traumatic corrective surgeries. Now, this is particularly close to me because as a growing maxillofacial surgeon, when you are a young surgeon, people don't tend to come to you for your aesthetic surgeries because they perceive you as a young surgeon, inexperienced. So you don't get much cases in the beginning. So these are the cases where you can actually build your name. So this case was treated by another plastic surgeon long back, and the patient was really not happy with the aesthetics, flat face, dish face, he was not happy. So now these kind of people that you get, so when he came to me, can I do something about this? I said, yes, I can. So this is where I did a leaflet 1 osteotomy, I did a rhinoplasty, and then got him to look more better. It's not like transforming his face, but he looks much more healthier. His cheeks looks much more proportioned. His nose is much more proportioned. So these are the cases which you get as a maxillofacial surgeon, as a young maxillofacial surgeon, which helps you grow your name as an aesthetic surgeon. Because for him, you are an aesthetic surgeon because you address his aesthetic problem, not just his functional problem. Along with that, down there, these are small things like lip. You can make your pouty lips. These are in thing now. So this is again comes into a scope of practice, lip surgeries. So you see the scope is huge. And the only thing is that the surgery is an ever evolving field. It's one field where there's constant learning. Any kind of field. When you go, if you look at endodontics, it's an ever evolving field because you have new techniques coming up, you have new materials coming up. So if you're not up to date, you start lagging behind. Same goes with the surgery. If you're not up to date with the new techniques which are coming up, if you don't attend new workshops, conferences, you don't know what is happening in the world. It's not about just being in India. A lot of things, most of the things, in fact, as by my experience, majority of things are happening outside India as of now. And you have to be updated. So that is where it's become a little difficult for us because going outside is a little expensive, but one should keep trying to keep their knowledge go up and up. And if you compare if I see my techniques, when I compare my techniques in 2018, and I compare my technique now, what I do for the same type of surgery, it's vastly different. In fact, since last year, my surgical technique for the eyelid surgery is completely a new technique, which I've done by combining 2 different techniques. I'm also coming out with an article regarding that particular technique. So it's always about moving ahead, reading different journals, getting yourself updated. And also what I would suggest all postgraduate maxillofacial surgeons is that when we are taught as a singular subject, like it's all maxillofacial surgery. It's not only maxillofacial surgery. You have to interact with your colleagues. You have to interact with prosthodontic colleagues because they come up with different things with the occlusion part. which can actually help you in your joint pain, migraine pain. When you start maxillofacial surgery or facial plastic surgeon, patient with facial pain come to you. And if you're completely unaware of the advances taking place in the TM joint and the occlusion, you'll never be able to give a good treatment. Same way, you have to be in touch with your ENT colleagues, your neurosurgeons, your oculoplastic colleagues, your plastic surgery colleagues, because every specialty has something different, something special to contribute. I may, as a maxillofacial surgery, I may have few special things which I learned during my specialty. An ENT surgeon or a plastic surgeon may have learned something new which I never knew, and that is how things grow. So going ahead, I would say attending workshops, reading journals, conferences are the way forward, is the way forward actually for all kind of specialists. And about the field of maxillofacial surgery, I would say it's a long gestation period, a steep learning curve in the end. I'm being very blunt, very honest with this. If you want to do pure maxillofacial surgery, the gestation period is long. Yes, the training period is long. Before I started having my own patients, people started searching for me. It's taken me 6 years. And it's taken me almost more than 6 years actually. Now people look for me, they ask for me, they search for me, and they come to me. So now I've fixed my surgery as per my schedule. But before this, it was not like that. I've operated at morning 5 o'clock. I've attended emergencies at morning 2 o'clock, and then go back to your normal duty at 7 o'clock in the morning as a consultant, not just as a resident. So it was there. I used to work without rest. My family side used to get affected. But yes, I made a point that I never work on Sunday. So it's only 1 year in my beginning when I worked on Sundays. After that, yes, I never worked on Sundays. In Sundays, I'm a very lazy person. So it's for the family. So yes, you have to balance your time with your family. You have to give time. You cannot give the whole week to your family, but you have to take 1 day off. And I made my point that Sundays is for my family. So I don't work on Sundays at all. And again, as I say, I don't believe in the term saturation. No field is saturated in this country. My brother, for example, he's an engineer. People say engineering is again saturated. That's what they say. But even it took him 2 years. He did his specialty in vehicle and mobility designing. Now he's one of the main designers in TVS motorcycles. So it took him time. After graduation, it took him almost 3 years to get a job. He's now in a fantastic position. So it's never saturation. Always critically analyze. My wife sometimes says I'm too critical of my surgeries, of my surgery results. But then because I'm too critical, I can confidently say my results are on par with most of the surgeons across the subcontinent, I would say. And so that is one thing, critical appraisal right from the internship. This is one thing if we are taught as graduates that to critically analyze each and every case of yours. So hard work, perseverance is very important. Challenges in maxillofacial surgery, long training time. Most of the time, in a lot of time, you can establish your clinic, you start practicing majority of practice right away. But in maxillofacial surgery, you can't, because post-graduation gives you only 20% exposure. It doesn't give you 100% exposure of the entire spectrum, because 3 years is not enough, frankly speaking. So it's huge. Learning time is long, long working hours initially. I used to, like I told you before, I used to come back home maybe at evening 7, get a call, trauma case, get a call at 2 o'clock, go back, operate that case at morning 2 o'clock, finish it by maybe 6 or 7, come back home, freshen, have breakfast, go back again at morning 9 or 10. So yes, you have to give time to build your reputation, because the senior doctors who call you, they like it when you have a person who can back you up at any point of time, at any hour of the day. So that is how you build your mark. And yes, if you want to excel in maxillofacial surgery, you have to leave a general practice. It's not possible to put your feet in two boats and travel. It's not, sailing in two boats is never advisable. That's my personal advice to all people, because it's very easy. I can ask you directly, doctor, will you go for your rhinoplasty to a surgeon and you go to his clinic and you see him doing an RCT? So you will get your doubts. He's doing an RCT. Is he qualified to do a rhinoplasty? That is the question that comes to your mind. So yes, you have to leave your general practice to excel in this particular field. And that does have financial impact initially, it's true. Initially, when you come, you don't get cases as a youngster. You have to join as an assistant, and you get peanuts for being an assistant. And it's difficult, not that easy, but you have to do the sacrifices. So these are the challenges, few challenges. And also among the challenges which I faced was the lack of awareness among the common public, lack of awareness among medical colleagues, lack of awareness among dental colleagues. Even dentists don't know the scope of my specialty. If you ask, most general dentists will be like, can a surgeon do blepharoplasty? Is it rhinoplasty? They don't know it is there. It's in the spectrum. The only thing is, because not many are doing it, we don't know. And yes, going to hospital, you don't have much scope initially, as in hospitals. So there is a struggle initially. You have to fight it out going inside, but it's never saturated. Pros, the biggest pros of following your passion, maxillofacial surgery was my passion, facial plastic surgery is my passion, and is that professional growth and satisfaction. When you're satisfied with what you're doing, what you're working, there's nothing better than that. Professional growth and satisfaction, you cannot compare it with anything else. That's what I feel. It's my hobby. Reading is my hobby now. Surgery is my hobby. I can just keep on doing surgeries, never get tired, never get bored. And in the end, we all are working to earn money to have a comfortable life. And once you're established, financial benefits are immense. Okay, it's huge. Honestly speaking, when I speak about the hours given into the work and the money you're getting paid for every hour, doctor is still among the best earned professions. If you count a number of hours you're working and the amount of money you divide with that, the money for an hour, the specialty is still good, not just specialists. I'm talking about all doctors, be it a general dental dentist, be it a general medical practitioner, a specialist, anyone. So once you're established, the financial benefits are immense. And the best part is, once people come searching for you, you don't work according to somebody else's time schedule. It's your own time schedule. I fix my surgeries as per my convenience. I fix the date of the surgery that, yes, on this date, this time, I'm going to do your surgery. And it's fixed. I have not to go at morning 9 o'clock, 9 to 5 job. No, I'm not doing a 9 to 5 job. Like today, I didn't even go to my clinic. I just told on Saturday that, yes, I have to prepare for this presentation. I'm not coming. Tell my patients the doctor is busy for today. And all those patients who have wanted, I have a busy schedule tomorrow and day after. But that's how I can go on holiday. I took off a month off for my brother's wedding. And yet when I came back, my practice was busy again. So yes, you are your own boss as a professional. That's the advantage of being a professional. And financial benefits, once you're established, yes, it's a challenge initially. Many people will, they'll give you a hard time. Okay, you studied so much, you're still struggling. What is this? You're still not earning well. So that's there. That's in everything. It's not just dentistry. People say dentist saturated. No, it's not just dentistry. Even I've seen my brother struggling initially. So yes, pros is that if you're a professional, you have your own time, your satisfaction, your growth. Take-home points for graduates and postgraduates. I would say that follow your passion. We know that our system is a little different. Most of us don't even know what is dentistry when we join dentistry. We just join dentistry most of us, just for the heck of it, either we did not get medical seat, or very few who get through, who choose dentistry in the initial part. But once you do it, you can develop your passion towards it. It's a vast field. So it's not that difficult, it's not that difficult to build your passion in dentistry. Perseverance, hard work, dedication, and sincerity. These are the 4 things which don't have any replacement. When you have all these 4 things with you, luck will follow you automatically. It's not that people are lucky they got it done. No, people are lucky when they have perseverance, hard work, they are dedicated, and they do work sincerely towards their work. My brother tells me, my elder brother, he is a doctor. So he tells me, it's not about intelligence always. It's about the wall and the hammer and a nail. If you just hammer the nail once, it will not go inside. But when you keep hammering it again and again, keep hammering with perseverance, hard work, dedication, and sincerity, the nail is going to go inside the wall. So it's about hammering, not just during your graduation. It's during your entrance examination. It's all about hammering the nail into the wall. And for those who fresh pass outs, maxillofacial postgraduates, I would say stick to specialized practice. It's not worth spending 3 years of your life into one particular specialty of surgery, and then you go out and you start doing general practice again. You're not doing justice to your specialty. You have to work towards your specialty. If I can do it, then anyone can do it. Just about hard work, dedication, sincerity, and perseverance.
Absolutely correct. So yeah, all the viewers, if you've been listening to the session, then thank you very much for listening. And you see that how, the pointers that he has made. If you want to get into facial plastic surgery, Dr. Gogoi has already mentioned the courses which are there. And the one thing that he always sticks by is, if you are into some specialty, please make sure that you're practicing your specialty and not just practicing general dentistry, but make sure you're doing justice to the specialty that you have been doing for 3 years. That's not a small time. 3 years is not a small time. So I hope that you liked this session, and thank you very much, Dr. Rahul, for coming on our platform and sharing such wonderful information with the audience today. I'm sure the audience who's listening to us today, they might get motivated with this session, and they might come reach out to you for more queries on facial plastic surgery as a subspecialty. So thank you very much once again for coming on our platform and sharing all this information with us.
It was my pleasure.
All the audience for listening to the session, thank you very much for attending our session today. I will see you in the next session. Before that, please subscribe to our channel. It's absolutely free. Like and share this with your in your network, any friend of yours who is into oral and maxillofacial surgery and wants to diversify as a facial plastic surgeon, just like Dr. Rahul, then please share this in your network. I will see you in the next video. Until then, bye and good luck.